see people wearing their masks and being respectful. I see the stores that are open doing the best they can. And I know here in the county, we are disinfecting things constantly. I'd like to thank our employees too, because they've stuck with us and they've done a great job. But we are doing a good job here in Susquehanna County because we are responsible, respectful people. And we can make this happen. We can open our county safely. And that's what I would ask Governor Wolf. Please, Governor, put us in the group of counties to open in this next rollout. We need to get people back to work. I know there's a lot of fear, and I know there's some people that are against it, that don't think we should open. But we are an independent people here in Susquehanna County, and hardworking people, and a lot of business owners and self-employed people. It's been 8 weeks for some people to have a check or to be able to work. They need to feed their families. They need to salvage their businesses. So we need to get back to business and move forward. And as we do so, we need the people of this county to continue following the CDC guidelines. I don't want to see it turn out to be a Wild West show. And I don't think it will be, because I think all of you are very conscientious. We all have loved ones. We have a very high elderly population in our county. My own dad is 91 years old. I miss him terribly, because I haven't been able to go and see him. So, excuse me, sorry about that. I get emotional. So please, Governor, please consider opening us in this next round. And to my constituents, thank you, and let's carry forward. We are Susquehanna County strong. We can open safely and get back to business and take care of our families. Thank you again, everyone, for coming out today. I appreciate you being here. Thank you, Commissioner Hall. I couldn't ask for 2 better commissioners to be working with. I'm so glad that you and Commissioner Herschel are beside me. Thank you.
Thank you, Chairperson Commissioner Reynolds. And now we'll hear from County Commissioner Judith Herschel. Judith?
Thank you, Commissioner Hall. And I also want to take the time to thank everyone for being here and participating today. We have 1,794 businesses in Susquehanna County that make up about 11,000 employees. Roughly 2,000 of us who work in or own small businesses have not been working and have been hit pretty hard financially these past few months. This number does not include those working in the restaurant industry or those who are working but have had their hours cut. But they do represent a good number of people who are scared and are frustrated. And many of them understand that we have hit the target numbers regarding percentage of cases that were set by Governor Wolf himself as a benchmark for a county to move into yellow. And they want to know why they are still told to stay at home. I get it. I understand the frustration. When do we begin to open up our economy in Susquehanna County under Governor Wolf's color plan, and to do it safely? The county commissioners do not in any way, shape, or form determine any aspect of that decision. Governor Wolf has put forth several benchmarks throughout his color stage system. I have personally requested, as early as today again, that his office offer clarity and make necessary assistance available for us so that we are able to do what's necessary for Susquehanna County to move into the yellow stage and to move into it safely. I also have requested assistance through the Department of Health in acquiring the necessary testing that we will need in order for a long-term mitigation to be successful. Not having the ability to track cases, current and recovered, asymptomatic and symptomatic, is like driving a car blindfolded. The testing is the eyes of the driver. It allows us to direct our attention and focus on the problem at hand and move into the future to mitigate COVID-19 in our community. Today, we have begun to stabilize our numbers. Businesses, I am seeing personally, are adjusting. People are wearing masks, but some of them in our community are getting tired of it all. But it is so important that we continue to follow CDC guidelines. We don't want another spike, and we want to be able to move forward and open up. But I will will not condone any businesses or any events that do not follow these guidelines, and I will not condone anyone breaking the law. I also will not condone any downplaying of the importance of safety, and I do not personally believe that we should move directly into the green. We all have a loved one at risk. 21% of our community is 65 and older, most of which have a pre-existing condition, most of which also lives with us, their family, and we want to keep ourselves and our families safe. Most people and businesses I have seen do understand that safety is important. Some, I understand, do need reminders. And as we move forward to open the economy, we can manage this situation if we keep that as the forefront and do what is required of all of us to keep each other safe, all of us. We, all of us here, need to do our part by listening to everyone, representing the community as a whole. It should not be about politics. It should not be about choosing sides. It should be about doing whatever it takes to get through this together. Please also understand everyone in this community is struggling in some way. Be kind, support one another, support our businesses, our essential workers, follow the guidelines, maintain social distancing, avoid groups larger than 10 people right now, and please, please, please be safe. Thank you.
Thank you, Commissioner Herschel. So when you came in today, I did put some handouts out for everybody to be able to deal with. If you don't have them, I'll give them to you, but I'm a numbers guy, and that's one of the things that I'm really good at. So this sheet here that you'll see, the large one, and you'll each have a copy of it, that gives you the details of every county in the state of Pennsylvania, not only the number of cases, the number of deaths, whether they increased, decreased, whether they're staying flat. It's all color-coded, as well as their last 14-day look back. Those are the numbers that I watch constantly. This is the map that I look at, that for the state of Pennsylvania, for the counties, what's moved into yellow each week. And again, we also have other additional information. Our county commissioners, we banded together and we sent a letter to the governor of the state of Pennsylvania with a plan to help open our county. That letter was sent a couple of weeks ago. That is also in the packet. The letter's attached, as well as doing your part, trying to do everything we can to get our businesses to follow the CDC guidelines. This letter was sent. We have not yet received one reply from the state of Pennsylvania, which is very disheartening. So as we continue to work hard to try and move things forward, today I've just been informed that at 11:30 the governor is going to have a new press release, another video response to the reopening of Pennsylvania. We're not sure what he's going to say. We hope that it's positive. At the same time, we received this morning. It's another letter. I'll make sure everybody has a copy of it, from the insurance department. Warns of risk, increased liability, and non-compliance of business closure orders. This is coming from the Pennsylvania Insurance Department. Basically what it's saying is if anybody defies the governor's orders, you could be subject to lose your insurance, or the insurance company's not paying any of the claims, and you'd be personally liable for it. We also know that, several counties, county commissioners, DAs, have made some stances as to what they're going to do. Most of them are letters of intent. Their letters of intent are that if the governor doesn't take the action, that they will look at the intent of trying to do something themselves. With that said, I don't think any of us. I know that I personally would love to say, we need to get things going. But at the same token, there is risk, liability, and responsibility to every decision that's made. And unless you review that decision and analyze it, you don't know what those conditions are. So first of all, let it be said that the county commissioners have no authority to override the governor, open a county, close a county. We have no authority over any of our municipalities to tell them what to do. They are governed by themselves. At the same token, there are counties that said that they're gonna do things, like Greene County and other counties. They've already received warnings from the state that although the county commissioners or the DA may do something, that the state still issues licenses for barber shops, for realtors, for Department of Health, does work for the food industry. All of those things could be in jeopardy. As well as we've just found out this morning again, in another blow, that because of the devastation to Pennsylvania financially, that we will be seeing funds being cut for our 911 centers and our emergency management and public safety. And nobody's talked about that elephant in the room, the billions and billions of dollars that has been lost in the state of Pennsylvania. Excuse me. But it's not about just the dollars. Again, we talked about the safety of the individuals and our numbers. We know that our numbers are basically from a nursing home in one portion of our county. Thank you. But our county is all small businesses. Why is it that big box stores can be open? Here are small retail stores that sell the same thing cannot. This continued closure will have more devastating effect on the residents of Susquehanna County than the potential loss of life. Our county will see more loss of life from the closure than it will from the disease itself. Our small businesses are failing and will not reopen. If they do, their debt load will be so high that they will probably go out of business within 2 years. Our residents have been laid off for 6 to 8 weeks. Most of them have not received a paycheck at all from unemployment. Grocery stores are rationing meat if they even have it. You say be strong, stay at home, and there's plenty of food. Well, you're wrong on all counts. I realize that the people that are making the decisions are getting paid or have so much money that they don't need a paycheck. None of you remember what it's like to live week to week, if you ever did. We have 81 cases in our county. 13 in the nursing home have passed away. Our at least 14-day look back now is at 0. That means possibly 66 people have recovered, which we have no status on. You need to have some faith in our local government, as we know our communities better than Harrisburg. Your one-size shoe does not fit all. To me, this looks like you are discriminating against our county, just like you have with the roads. We have the worst roads in the state, and now they are getting worse day by day. You are losing control over the state with the actions that have been taken. Help us keep things in control by immediately moving us to the yellow and allow us to work with our business owners and residents to follow the CDC guidelines. Live up to your words that you care about all Pennsylvanians, including Susquehanna County. Show us that you are a decent human being and help us help you to keep Pennsylvania moving forward. Now, in no time have I said that business openings or anything we do is more important than loss of life. It is not. We need to take care of our elderly, those that are the most dangerous of getting this disease, and doing the right things. And we need to do everything in a smart and organized fashion. At 11:30, as I said, the governor will be on again today with a message about the reopening. We're all hoping for positive information. The district attorney unfortunately couldn't be here. She has said if anybody has any questions, you can reach out to her office by phone. She will be glad to call you. The issue of not following the guidelines out of Harrisburg. Although I want to scream as loud as I can and try and move in the right direction that I think the people want to move in. We cannot put our people in more harm's way by people losing their licenses, their livelihoods, and even if the DA does not want to prosecute in our county, that does not stop the governor from getting the Attorney General to come in here and prosecute people and pull them to another county to prosecute. So we need to be cautious. We need to do the right things. There's been actions taken already, lawsuits. The governor has one in the PA Supreme Court, also the US Supreme Court, on work closures itself. We need to do the right thing, and there's a big difference between action and effective action. To be effective, it has to be legal. We just can't do things to defy. We have to find a legal recourse to try and get our county open. We must first appeal to his human nature, his decency as a human being, as well as the Department of Health, and say, help us move forward. Tell us what we need to do to move forward. I will remind everybody that the commissioners of Dauphin County went on to say that they are moving their county, that they will be with the intent of moving their county to yellow. Unfortunately, the mayor of Harrisburg itself, the city, said, I will not comply, we will stay red. So again, that's a demonstration as to how much authority a commissioner really has. So again, I want to thank everybody for coming. We have probably about 5 minutes for questions, if anybody has any questions at this time.
Mr. Hall, I guess my only question would be about, do your part and stop the spread. Is this just the guideline for businesses that can be open that are essential? Can you just branch off that? Because I know that goes with Berks County as well.
So what we did was we put together this program. That letter that it's attached to is a letter to the Governor Wolf and the people. And basically what this is, it's all about trying to educate, especially those businesses that are not essential, the ones that will be opening in the yellow phase. The issue we want to deal with is we want to make sure that when we go from the red phase to the yellow, that we don't get a spike and then get the word that we're getting put back into the red phase. So we want to go out and educate. Our plan as the commissioners is to go out and educate our business owners, get them these posters, educate them as to what they should be doing to follow the CDC guidelines so that they can keep not only themselves safe, but also the residents that are coming into their shops.
Worst case scenario, if you guys are able to move from red to yellow, and, maybe people aren't listening, or you have better, testing or whatever, and you find out that you have more cases than you do right now, and then the governor says, actually, you have to move back to red, would you be prepared for that scenario?
Well, I don't know anybody in the state is gonna be prepared for that scenario. Everybody's been in the red. We've been closed for almost 2 months now. People, even if we try to tell people that, they're moving back to the red, we're gonna have a hard time as any kind of leaders in the state trying to convince the public not to move around and start doing things. But we will do our best to try and keep everybody safe in this county the best that we can. Any other questions? Yes.
And this for you, or probably more so to the legislators in the room. Last week during one of the press conferences with the governor and the Secretary of Health, there was a direct question regarding Northeast Pennsylvania, and specifically I think it mentioned Wyoming County. And the response came that Northeast Pennsylvania, such as Lehigh, Northampton counties, that their numbers are still too high. What have you been doing to help it be more recognized at the state level that Wyoming County, Susquehanna County is a far different beast than what you have in the Lehigh and Allentown area?
Let me just say this, and then I'll open it to the legislators if they want to respond. At the county level, we continue daily to try and communicate with the governor's office, either by phone calls through the Northeast office, or emails, or letters, trying to get information or to provide information as to where we're at. Even if you look at the governor's website on the graphing, you'll see that with the graphing of cases that the Northeast group, Susquehanna County, is the lowest out of all in the entire graph. We're basically at 0. So I don't know, even their own information is telling them that. I think I was a little more concerned when I heard the press conference out of Harrisburg, when they said they're talking to the county commissioners and talking to the counties, and they know what's going on, and yet when somebody talked about the Northeast, the most they could talk about was Lehigh or Lancaster or Lackawanna County. But there's never been mentions about Wyoming or Susquehanna County. So there is more to the Northeast group than that big block that's down below us. And the bigger concern is this Friday, Broome County, which is above us, is opening. And our concern is that our people, will be flocking to Broome County to get some type of social activity because we are locked down in this county. So in order to keep our people here and keep them shopping in our stores instead of going to the big box stores in New York State, we really need to get our county opened up. I don't know if the legislators want to add anything to that.
Stacy, I represent both Wyoming and Susquehanna County, and we have, as a delegation, written letters to the administration communicating our frustration about, as I mentioned earlier, arbitrary lines of a Department of Health district that differ greatly from our economic development lines. So you look at the Northern Tier, you're part of the Northern Tier planning. You're not part of the Department of Health guidelines that take you into Lehigh Valley or Hazelton. If you look at Luzerne County as a whole, and there's great frustration in pockets of Luzerne County, the bulk of the cases there are in the greater Hazelton area, 40 minutes from the back mountain, and yet that zip code where I live, right on the Wyoming County line, is lumped in with the greater Hazelton area. So we've been communicating, but I have to say the responses have been non-existent and very frustrating. I've had direct phone conversations with the governor's office, with his chief of staff. After the first Friday when Wyoming and Susquehanna County were not included. And my phone line has blown up over the past several days, especially on Friday, about the frustration and the idea of looking at our numbers and not reaching that conclusion. So we've communicated, we've advocated, we've passed legislation, and we're going to continue to take all those appropriate steps. But to say it's frustrating to represent a region that is identified and misidentified by the administration, they don't know who we are, where we are, and what the impact has been to the people. And that's what's been so frustrating when I hear from individual businesses and families.
Any other questions?
Are there concerns that, that if this continues, I mean, obviously there's been a lack of communication that you've been experiencing now. Are you concerned if that lack of communication continues in the moving process from the yellow to green phase as well?
Well, yes, I think there's a lot of frustration over the communication process, the transparency and the openness, trying to get the data from Harrisburg, trying to find out what the rules are, what the benchmarks are. Listen, like I said, I'm a numbers guy. Tell me what the numbers are, tell me what we gotta do, we'll figure out a way to make it happen so we can do it. But if you don't tell me what the rules are and what I have to do, then we can never get there. So, yeah, we have a lot of concern from one phase to another as to, how this is gonna be done, when it's gonna be done. We have nursing homes in the area, and unfortunately, out of 4, one of them has an issue. The other 3 do not, and but people would love to go see their loved ones, but they're locked down, nobody can get into them. People would like to get out and do some activities with other people,